Hello, everyone. Good evening. Let me hope you had a good day. Welcome to this webinar. The webinar is entitled Empowering New Nurses. I'm Dr. Miriam Smith, the host for Empowering New Nurses. And so I'm excited this evening that you're here with me as we share, some of our experiences. And I'm an advocate for new nurses, very much so. So, to begin, the first thing I would like us to start thinking of is our objectives. What, what are we planning to learn? What are we planning to take away from this? Well, I'll tell you that my goal is for you to be having the right mindset, be empowered to have the right mindset, which is the growth mindset, and our practical strategies for success and how we can build confidence as a new nurse. We have some questions and we have some answers. And of course, some special resources and what will be your next step. So here we are. There are many challenges that new nurses face. Sometimes they do feel overwhelmed in a fast-paced environment, especially when the unit or the floor is very busy, when patients are unstable or patients are critically ill. Now, nurses also, new nurses, they manage self, they experience self-imposter syndrome. What's that? They don't feel confident. They feel like they are unable or they're not enough or they're not capable of doing their work at that point. Balancing work life, when you've just started, you find it difficult. New nurses find it difficult to be at home and at the same time to perform at work. That's a challenge when you've just started. Moving from a student to a what? A nurse in a different capacity. So getting confident, to become confident in clinical skills, it can be challenging at first until one has started gaining more and more experience. So the transition from a student nurse to become a registered nurse can be challenges, as I said before, but that comes with time. So the power of the mindset, as you might know by now, that we have the fixed mindset. There are two mindsets. We have the fixed one and the growth mindset. No one wants to stay the mindset that you feel stuck in one area. You can't move. You can't position yourself. You feel as if you're hopeless. That's what the fixed mindset is. Limited. There are some words that go exactly with when you're fixed. Words like, I can't. I feel limited. This is the way I am. So we don't want to embrace those words because the sky is the limit and you do have great potentials. So what you definitely will do, what you will ensure is that you will move forward. You will move forward. Okay. And the sky is the limit. If you're feeling stuck, you have to make sure that you can move forward. And you have to embrace the words that I can. And I can do all things through Christ who strengthens me. You can. You might have to change your strategy and move forward, but you can. All right? Now you have to overcome some self-doubt. Yes, you haven't gained that amount of experience as yet. However, you can move forward. How are you going to do that? You're going to be practicing. You're going to believe that the studying that you have been doing over the years and the preceptors and the educators, the personally, your colleagues, you believe in what they have helped you with, and it's just a matter of time. So you have to be an overcomer of self-doubt, and you have to stay positive. Positive, yes, that's important. Challenges are temporary. Did you know that? Challenges are temporary. So you have to persevere. And as you persevere, you become stronger. All right. You have to adopt the growth mindset. By that, I mean, learn from your mistakes. Opportunities are there. Don't run away from them. Run into them because that will help you to cope as you go along. All right. Stay positive. Stay positive. Don't put any limits on yourself. It's so important because many individuals could have achieved much more, but they put limits on themselves. And that is a part of the fixed mindset. So we don't want to stay in that frame at all. We're going to run out of it quickly. All right. We all experience a little of that at times, but we have to be intentional about not staying and in a sphere of being stuck. Use that challenge to move forward, to propel you forward. Use that challenge to learn what are the lessons to be learned from that. So that's very, very important. My young nurse, do that. All right. How now? There's some practical strategies that we can utilize and how these strategies can help us along to thrive. Now, think about this. Time management. Time management does not come easily because it's something new and you have to manage your time to get certain things done within a certain time frame. As you develop your skills in time management, you will realize, and as you gain more experience, you realize more and more that it's doable. But at first, everything just seemed overwhelming. So in that case, you'll definitely have to plan. Plan what you're going to do. You're going to prioritize certain things according to your patient's condition. So you prioritize your task and use a checklist. Now, when we say a checklist, have something for yourself. Okay, as a reminder, in these times, what we are having, we have the computer, which is real time. So as far as possible, chart as you go along, and that will help you. But you must prioritize what is first. If the patient is going downhill, if the patient is deteriorating, are you going to be doing something else over there when you have to prioritize what next? What is first? What is second? What is third? According to acuity, diagnosis, and all of that. After you assess your patient, if the patient's having a fever, you're going to wait till how many hours after to say, mention or check, recheck, the medication for fever, reporting it, and stuff like that to get action. Actions must be taken. So as you assess your patient, it's not just getting the information, but taking action upon what's needed to be done now. All right. So time management, you got to, because there are certain medications has to be done in certain time frame. All right. Seek mentorship. Seeking mentorship is important. Build a support system of experienced colleagues. You have friends. You make friends. You find someone who is willing to share. Develop a relationship, embrace it, and learn from those who have passed this way before, those who have the experience more than you do, because you too later on will have to share with those who are coming after you, behind you. All right. So you make sure that you do that. Then you embrace feedback. Uh, the nurse might observe a senior nurse or another nurse, or might observe you doing something that should be done differently, or to help you not make the same mistake or change from one side to the other. Observation that will help you, both helping you and to help the nurse, helping you to give the high quality care to the patient. All right. Say, for example, your patient is being catheterized, and the nurse observes that you have broken the sterile technique. And she, of course, sensitively, tactfully corrects you. So she might just hand you another set for you to continue. Okay, it's for you to accept that and know the rationale why and move forward. The patient not necessarily have to even realize at that time or realize, but the way the other nurse does it tactfully, and you realize. After, you can discuss that, and you'll see why, and you can share that, and you'll say, oh yes, I understand. So don't have the air up that you can't take correction. It's important for you to learn. Okay. So feedback, constructive feedback, will help you grow, and you should embrace that. What about self-care? Yes. Protect your mental and your physical health. As a young nurse, you might just feel like you want to just do everything. You just want to just get everything done, and you forget yourself. You want to do just everything. You want to do the overtime. You want to do the shifts. Yes, you're new. You have the energy. And there are times when it's important that you do that. However, do not burn yourself out because you're trying to get all the money and forget your health. So the physical, you make sure you take care of yourself. You eat properly. You get enough rest. You take your exercises, right? Mentally, make sure that you take time out. You embrace the positive things. If you're not feeling well, don't push yourself. Don't overpush yourself. Develop a good relationship with others. Don't hold grudges. The patient is the center of care. So if there might be a misunderstanding, it's best to clear it up before it reaches too far. So remember, when we come to work, where the patient is the center of what we're doing. And that's the patient number one. So if somebody said something maybe in a code and it seems sensitive, try and deal with that after, not during the code. So the patient is number one. So how about building confidence as a new nurse? Think about it. You have to master the basic things: vital signs, setting up an IV, the small steps, making sure our environment is clean, our patient, making sure our patient's medications, you know the side effect, that you can teaching to our patient, teaching to our family members. All those pointers are important. Okay? Ask question. It is better to what? Ask question. It is better to clarify than to guess or to go and make mistake, because that can have serious adverse effect. So you don't want to that. Then there comes a time when you reflect on your successes. Yes, you can keep a journal or a notebook, whatever that is. Record your successes, no matter how small they are. It's still a form of growth. And then eventually you can look back, learn from your mistakes, Each challenge makes you stronger. Did you know that? Don't give in. Don't give up. If there is a topic, if there is some information or a skill that you're challenged with, spend some more time. And that's how you're embracing the growth mindset. Spend some more time with that topic. Ask questions. Go in the lab and practice. Ask the simulator person, director, or whoever. Ask some other friends. Ask your manager. The opportunity is given you. You can go into the lab. Use your own time. It doesn't have to be their time, but make sure that you feel comfortable and confident, and you have the rationale behind it. Learn from your mistakes. I, as an educator, I can recall, say, for example, uh, insertion of the catheter, Foley catheter, urethral catheter. And I recall in many times, although I have, or the other instructors have stated how and demonstrated, for example, the Foley insertion and what to look for and where you're going with the catheter. You explain, you show, you demonstrate, you everything, and you emphasize. And now it's time for participation. And the exact thing that has been emphasized when checking around, guess what? That's where one or two or a few of the nurses might insert the catheter at the wrong orifice. And so I would say something like this. All right, let's stop. This is not punitive. Where are we supposed to insert? And you'll see individuals looking, some of them seem frightened, some seem, I said, okay, this is not punitive, but I know you will not do it again. Where do we find the meatus? Where do we find, under where, what are we looking for? And with that, you see some individuals laugh, smile, some are terrified because they made a mistake. So therefore, that's how close it is. That's what it's like, learning from our mistakes. And you'll see those people, they'll never make that mistake again because they know where to look for and they remember their experience. And others around will be reminded where to insert the catheter. In the female, we don't have that problem with the male, but in female, you understand. Those of you who have had that experience know that. So confidence will come over time. Confidence will come over time. And as you grow, remember to share and to pass it on with others. Now, question, what challenge are you currently facing today? Okay, you might be having a problem facing reading the EKG and you're in a unit where the patients are being monitored. Or you might find it difficult to provide care for the number of patients. Ratio, nurse ratio, you're expecting to have more nurses for the number of patients. And that too can be challenging because nursing has been in a shortage for a while. More so, many of the baby boomers like myself have said goodbye to a certain point. And so it can be. But ways of working this out or resolving this for this time period could be group work, teamwork, working together to ensure that the patient gets adequate care. So that's vital. That's vital in these times. How can you best support you? Get some mentors. Listen, there are times You have to make sure that you go the extra mile for your patients. Say, for example, your patient might be on a medication, but the patient enjoys or takes it best with some applesauce rather than with the water, or maybe some orange juice, so long as it's not contraindicated. As a nurse, and as a prudent nurse, a nurturing nurse, a nurse who is called to the profession, it's okay to go that little extra mile. It might take a little extra time, but get someone to get that applesauce, for example, for that patient. That patient will appreciate you so, so much because one of their needs, one of their little idiosyncrasies, one of their little specialty that makes them who they are as an individual is being addressed. And so, as nurses, as I close, no question is ever too small. No question is ever too small. So we all can work it out together. Now, I've come to the end of this segment, of this session, and I want you to know that I appreciate you coming on. Now, call for action. Are you ready for the next step? Well, I would like you to get a copy of this book. Get this book so that you can dive deeper into practical strategies for success. I would also like to offer the attendees of this webinar some pointers that you can embrace, whether you're a nurse or not. And that those include the growth mindset. I would like to give you a few words on that embraces the growth mindset. I can be resilient, growth. You can embrace those. And statements like, I can do all things. I am a work in progress. And you can say, feedback help me to grow. I can learn from my mistakes. And with those words and those statements in mind, I encourage you to be confident, and I encourage you to move forward. I encourage you to ask questions. I encourage you to keep going and advancing in your nursing career, your journey. Make it special, make it outstanding. And in closing, I must say, as we celebrate Women's Month, make a difference in your care for your patient. Offer the best, offer evidence-based, offer scientific, offer the best care that you can ever offer to any human being. And that will give you a mark in the nursing profession and mark in your service, a mark that will reward you if you don't even get it from your patient. Be blessed. Now, how can you connect with me? You can connect with me on YouTube, Miriam Amanda Smith. That's on YouTube. All right. You can connect with me on Instagram, on Podcast Mayor. In addition, on our website is Empowering New Nurses. Thank you. I would like you to subscribe. I would like you to share with others this information and get your copy. It's on Amazon. It's a bestseller. Nurses, friends, you will be satisfied. Thank you.